So what is the difference between being a certified MLT or MRT and having to be a part of a regulatory college? What's the difference in that?
From the lab technology perspective, lab technologists are required to be certified by the CSMLS, which is our national organization, the Canadian Society of Medical Laboratory Science. So in order to work in the healthcare field as a lab technologist in any province across Canada, quite frankly, lab technologists need to be certified by the CSMLS. That certification is a one-time, lifelong certification. And part of our issue is that some lab technologists in British Columbia could have theoretically been certified 20, 25, 30 years ago and still working under that certification, but they may not have taken any continuing education programs in the meantime. And we think that's where the issue lies. So you do have to be certified in order to work in British Columbia, and our public system and the private system recognize that certification. But there's a big difference between that and licensing or regulation of individuals. First of all, we would be licensing and regulating 100% of the technologists across the province. So we would actually know how many lab technologists there really are out there, and that would help us facilitate human resource planning in a much better and more effective way than it has been done by government in the past. And it would also require continuing education. The college or council or whatever is established to regulate and license individuals would determine what the continuing education credits are that are required every year, and individual technologists would be required to meet those credits over a period of time. And that, to us, would ensure the continuing competence and the continuing education of technologists right throughout British Columbia, which is not really happening right now to the degree that we would like to see it happen across the province.
With respect to the MRTs, the situation is quite analogous. They write an initial certification exam by the Canadian Association of Medical Radiation Technologists when they begin their career. But in BC, there's no requirement for periodic or annual or any kind of mandatory continuing competency and continuing education. So theoretically, one could have been certified 10, 15, 20, 25 years ago and have not taken any continuing education, mandatory competency programs that reflect some of the major technological and practice changes that have taken place over these many years. The other issue is that with respect to the CAMRT, the Canadian Association of Medical Radiation Technologists, they do allow a certain number of rights of the exam, 2 or 3. I'm not exactly sure of how many, but while you're writing the exam, some facilities basically employ this individual even though they haven't even technically passed the exam. So that is kind of a related issue. But I think that it's safe to say that certification is sort of like entry level into the practice, whereas regulation monitors and regulates your practice throughout your career lifetime.
Okay, thank you, Darlene. And Shauna, would you like to address that from a cardiology technologist perspective?
Absolutely. We have the same thing. We have an entry to practice exam that people write when they first take their courses and choose to enter. And currently they have up to 3 attempts. And sometimes in the mix of things, we realize that there are soft spots. And we actually have somebody in BC who has failed the national exam a maximum of 6 times and is still working at a hospital, and we are powerless to do anything about that because there is no legislative regulatory body out there that says, I'm sorry, you should be limited in your scope of practice. The other thing to consider is the fact that technology is constantly changing. You take a look at more advanced things like pacemakers and ICDs, even medications that are out there in controlling and treating heart conditions. Those have dramatically changed even in the last 5 years. And what type of safety is there to make sure that people are understanding what these patients are taking? So again, this is all really about patient safety, because even though the doctors do hold the responsibility of signing off on a test, a lot of the times it's a technologist that does the test and pass that along to the doctors, but how do you know that the test was done correctly in the first place? And that is a big concern.